Hey, what's up, everyone? Welcome to the Wealthy Dentist Podcast. I'm your host, Ward Powell. And if you're a dentist looking to crack the code on how to grow your practice and dominate in this space, then stick around. You're in the right place. Every week, we're sitting down with some amazing dentists who are doing incredible things in their businesses. We're talking about everything from how they keep their teams loyal and dedicated to how they stay ahead of the game in this crazy, fast-changing industry. You'll hear about hacks like using virtual assistants to free up your time, strategies to make more sales with less effort, and even mind-blowing stories about patents and inventions that are changing the industry as we know it. And it's not just about growing your practice, it's also about finding out what works from a clinical perspective. Whether you're just starting or you're ready to scale to the next level, there's something here for you. So buckle up, hit that subscribe button, and let's dive in.
I have been a consultant for 15 years, but I've been in the dental space for 40. So I've worked in the trenches. I've been a program director of a dental hygiene school. I know how to create curriculum. I understand the curriculum. I understand the most current curriculum. I love AI. I love business because my undergrad degree was a Bachelor of Science degree in mathematics and statistics. So I went from being a clinical dental hygienist to program director of a dental hygiene school, writing for a national magazine for the last 5 years since the new classification came out.
So I am so happy to bring in a well-rounded veteran in the dental space that's going to help us understand the epicenter, and this is a quote I'm stealing from her, the epicenter of a dental practice. Now, she is a 15-year veteran on the consulting side of dentistry, helping dentists understand what's going on in the center of their practice. And she's going to also share with us the importance of a registered dental hygienist. How important are they? And here to join us to talk about this today is Gabrielle Macher. Please help me and join with us in welcoming Miss Macher and giving her warm greeting. And thank you so much for joining us today.
Yeah, thank you for asking. I enjoy spending some time with my audience and sort of discussing things that I've been working in. And I have been a consultant for 15 years, but I've been in the dental space for 40. So I've worked in the trenches. I've been a program director of a dental hygiene school. I know how to create curriculum. I understand the curriculum. I understand the most current curriculum. I love AI. I love business because my undergrad degree was a Bachelor of Science degree in mathematics and statistics. So I know how this all relates to the bottom line. And plus, when I read literature and when I am trying to integrate it within dental practices, I am always reading it from the perspective of what does the literature say the percentages are of this and this and this. Does your practice look like the literature says that it should? We can get into that a little bit, but that's sort of my metrics that I measure all of my practices to, is the metrics of the literature.
So 40 years in the business. Wow.
I know I shouldn't say that because my daughter said, don't tell anybody that, Mom. People are just going to think you're old. And I'm thinking, I don't care if people think I'm old.
Yes,
I'm going to say that I think I'm wise and I've worn a lot of hats and I've seen a lot of changes within the dental industry. And after all that time, I'm still super passionate and super excited about where the field is going.
Great.
And the field we're now transitioning into is dental medicine.
Yes.
And that is super exciting with sort of what we know now, like from when I graduated from school to AI and the assist of AI and all of these things. I don't know. I think I'm excited for the younger generations of clinicians getting into dentistry now. So I think it's just going to get better as time goes on. And too bad, probably in the next 20 years, I'm not going to be a part of it. But we're just going up and away.
Yeah, so what inspired you to get involved with the industry in the first place?
What made me, I'll be honest. I finished my Bachelor of Science degree in mathematics and statistics, and I realized really quickly that whatever field would come of that, I wasn't going to enjoy it. I wanted a more sort of social field, hands-on field. And plus I had some debt from my Bachelor of Science degree. And I thought, how can I pay this off quickly? So went into dental hygiene. And you know what? Maybe at first it was kind of a desperate move, but it sure has created opportunities for me that I didn't even realize existed. And that's the other thing about dentistry. I mean, you can be a clinical dental hygienist, a clinical dentist, but there's so much more in dentistry that you can evolve into. So I went from being a clinical dental hygienist to a program director of a dental hygiene school, writing for a national magazine for the last 5 years since the new classification came out, sitting on boards of our college, and then what my real passion now is the consulting in terms of transitioning practices into a real perio-focused practice so that at the end of the day, we're serving our clients the best that we can. And that, I don't know, it's sort of what drives most dental practices. So my vision statement just is about something that we're all passionate about, as optimal patient outcomes.
That is wonderful. So as a registered dental hygienist, what have you found the most, or I should say a former registered dental hygienist, what have you found doing your work there essential to the practice of dentistry?
Well, they will say, and what we didn't know way back when I graduated was that 90% of all systemic diseases have some sort of oral manifestation. And so when I talk about us moving away from sort of what we call as a dental hygienist, a biofilm driven model, we are really going into what we call precision medicine, where we're looking at more than just the biofilms that create the breakdown of the periodontium, which in layman's terms is the bone structure holding your teeth in place. And basically we're looking at that. We're looking at 3 different areas, not just the biofilms, and we're identifying them and we're treatment planning them as well. So it becomes a whole overall body experience for the patient and for us in terms of treatment planning. So it has evolved quite a bit. Even 15 years ago, when I would be talking about the overall impact of the oral cavity and the lack of health, most clinicians, this was news to them. Now, 15 years later, it is even the layperson, 92% of people out there know that their oral health is part of their overall health. So the importance of the hygienist in every practice is they're the forefront in terms of bringing to light what is going on orally and how that's affecting a person systemically. And it can be quite life-saving for that patient. So I don't know, I can't think of anything more important. I think you probably see your dental hygienist more frequently than you do your medical doctor. And we have the ability to uncover all sorts of things that you may not know about, or we uncover for you.
Mm-hmm, mm-hmm.
And then all the while trying to maintain, or what I call, we're trying to get our patients to the parameters of health. So what that means is if we can attain the parameters of health orally, well, we most definitely can attain their overall, or we can affect their overall health. And then in terms of coming from the perspective as a consultant, basically we know then that also drives practice growth and revenue. The whole idea of trying to get a patient to the parameters of health and not just taking a patient and making them believe that a simple prophy is good enough, right? Because in 95% of cases, it is not, because 95% of our patients have some level of periodontal disease, and that one prophy will not get them to the parameters of health. And in fact, we know out of that 95% of clients that come through our door, 50% of them have a form of periodontal disease called periodontitis, which is in terms of sort of the worst classification of periodontal disease you can have, where it's breaking down the bone structure and people potentially losing their teeth, and it's affecting them systemically. So from that perspective, it drives, like if we really understand what the parameters of health are and what it takes to get a patient to the parameters of health, that in itself drives the practice in terms of growth and revenue. We've done studies, and I'm up in Canada, where we have found that the top 25% of practices that are producing almost 50% more than their colleagues are producing 70% more within their hygiene departments. So these are hygiene departments that are very optimized. They understand what the parameters of health look like. They understand the amount of time that they need to get those patients to the parameters of health. And then from that, they're not just looking at the biofilms causing the breakdown of the periodontium. They're also looking at other acquired and developmental factors that may be breaking down the periodontium, which is where when I say that, your 30,000 plus cases are sold, they're looking at that. And then they're looking at the patient on a systemic level as well, and how the inflammation in their bodies may be contributing to the inflammation that they're having a hard time to control intraorally. And that's the whole transition into what I call dental medicine, that it's really three factors that we're looking at.
And what are they?
Pardon me?
You said there were three factors that we're looking at?
Well, they say that 20% of the direct risk of getting periodontitis is due to biofilms. And although the dental hygienist spends 100% on the 20% that's breaking down the periodontium, the other 80% is due to other factors that are causing the breakdown of the periodontium. And the literature would call them predisposing factors, or they're things like predisposing factors, or they can be called acquired and developmental conditions, open contacts, breakdowns of the teeth, teeth that need to be replaced, iatrogenic incidences, things like this that need to be looked at on top of the biofilms. And then the rest is due to what's going on with the person systemically, which we call modifying factors. So that can be anything from, do they have diabetes? Do they smoke? Do they have cardiovascular disease, medications they're taking, things like that. So we have to identify the 80% once we've completed the 20% of like taking care of those biofilms. What else is causing the breakdown of the periodontium? And as a dental hygienist, that is our whole goal, is the preservation of the periodontium. So that's where we're the sort of at the forefront of identifying these things, and then bringing it, or the first person within the practice to talk about it, and then the dentist is coming in and talking about those other factors as well. So you ask, what is the importance of a dental hygienist? Well, they start the conversation about all of these things that then get addressed as time goes on. And if you're a patient of a practice and you become invested in the fact that that practice is taking care of more than just cleaning your teeth, right? They're taking care of your overall health.
Yes.
And that's the other thing that I talk a lot about, is we have to stop selling services. Like, we're selling a comprehensive oral exam, we're selling radiographs, we're selling a prophy. Instead, we need to create value and sell outcomes. If you really sort of understand where the profession of dentistry is going to, that is the end goal, is overall health, and creating the value around that. And it just so happens that in order to get you to overall health, you're going to have to take radiographs, you're going to have to do comprehensive oral exam. You may need way more than a cleaning. Most of your patients probably should be in what I call active periodontal therapy, and 50% of your patients should be in active periodontal therapy that probably includes quadrant and sextum scaling because they got periodontitis. And then going forward, they need to be on a 3-month recare, because we know patients with periodontitis, it's a disease that's only managed and never cured. And then with your hygiene team, they're identifying probably up to 80% of all the aesthetic and restorative dentistry, because at the end of it all, there may be the need to do restorative dentistry so that it doesn't impact or continue the breakdown of the periodontium.
So, given all this wonderful information, what are your thoughts about how many dental hygienists should be in a practice? Is it 1, 2, 3, according to how many doctors you have in the office? What are your thoughts on that?
You know what? I speak on this a lot. So the bottom line is, I know when I'm walking into a practice, if they have an optimized hygiene department based on those metrics. So if they've got one dentist and they do not have a 1-to-2 ratio, one dentist to 2 hygienists, I know there's an upside in their hygiene department in regards to optimizing patient outcomes. An optimized hygiene department, like I said, should be about 1-to-2. But I have dentists that have a 1-to-4. And when I say that, a lot of dentists will say, there's no way I can manage 4 hygienists like by myself. And I say, yes, you can, because if you understand the prevalence of periodontal disease and how many of your patients should be in active periodontal therapy, the bottom line is the majority of the time, probably 3 of your hygienists are working on doing quadrant section scaling. So you're not really needed in walking into those rooms to help manage those patients. You're probably doing the same number of recalls, the same number of new patient exams with those 4 hygienists, but the majority of those cases will be in active non-surgical periodontal therapy. So I have practices that I've worked with that have a 1-to-4 ratio, and it works just fine. But 1-to-2 is the ultimate in terms, or I can basically, when I see a 1-to-2, I think that is a pretty optimized hygiene department. Could I get some more of an upside on them? I sure can, but I'm thinking that it's not as much of an transition up as it would be if it was 1 to less than 2.
Oh, wow. So then we're looking at what, 4 to 5 operatories when you have 1-to-4?
Well, always I work with practices typically that have 6 ops. So they've got 2, and you know what, here's the thing. And then doctors will say to me, they would like 1 op, like 2 ops per doctor. And that's okay if you can make both chairs profitable. Otherwise, give them to me and I'll make them profitable with your hygienists, right? So if you had 6 ops, you've got 2 doctors working, or 1 doctor working with a second chair, and then 4 hygienists, or any combination permutation of that. That would be the ideal number. I always, when I'm working with practices, one of my first questions is, do you have room to expand? Meaning, do you have another operatory as you start to really integrate best practices in treating periodontal disease? Do you have enough room where you could get another hygienist, maybe initially half time and then eventually full time? It's always harder for me to work with dentists when they've got confined space and there's no place to kick out walls. I've worked with dentists that literally have started my program, and within the 6 months where we're just learning curriculum, they're building double the space, and within the 6 months time, they're kicking out the wall, and then all of those operatories are filled. Because if you really understand best practices in treating periodontal disease and what the parameters of health are, it doesn't take long before you're transitioning your clients into getting what I call 1-offs, which is your prophy, to clients that are needing anywhere from 1 to 3 to 1 to 7 appointments just for their initial therapy.
So you correct me if I'm wrong. It sounds like you were also speaking to some degree about the design of an office, the future of an office design and things of that nature. I mean, do you have the space, Mr. Doctor, Mrs. Doctor, to expand within the space that you've already purchased? Is that something that you kind of have a conversation about as well?
Well, I do have that conversation, and it used to be an easier conversation before COVID, before the shortage of dental hygienists. It would be, we can work with what we've got, because the bottom line is that we've got 12 hours in a day, and you probably could find hygienists who wanted to work split shifts and work evenings, work Saturdays. Nowadays, with the shortage of hygienists, not so much, right? So we're limited by needing more space and or bumping out your patients further, which is not a bad thing. There's many breakdowns that when I'm working with practices that I notice. First of all, it could be initially that in an 8-hour day, we fill the 8 hours, because currently, 1 hygienist is working or booked or scheduled for 8 hours, but literally they've got anywhere from 5 to 6 patients, and the rest are no shows or cancellations. So we start off by filling that. So that takes some time. And then what we do is doctors will say to me, well, yeah, my book is booked up for the day or the week, but then literally the day comes and it falls apart. So then we work on creating very trusted and committed patients and making sure that when you're booked out, you're booked out. Meaning when that day gets confirmed, it doesn't fall apart. And then we work on not just a week in advance, 2 weeks, then we work on building out your scheduler. So it's at 3 months booked out, and having the need to block appointments so you can fit in your new patients, right? So it'd be nice in the perfect world. Can we expand? Can we get more hygienists? Can we get hygienists to work longer hours? And maybe it's possible, depending on your area. I know there were times in my life there was no way I'm working evenings, Saturdays. Then I had kids and I had people at home taking care of them. So then I wanted evening Saturdays. So that's always still a possibility. But first of all, the sit rate has to improve. And it improves by creating the value around what you do. And I'm going to be honest, if your practice is the type of practice that just does prophies or cleanings, you're not going to create value around that. People think that's a disposable service. And again, that's a service, not it's not something that you need to maintain your overall health. So then we develop those committed clients that wouldn't miss their appointments because they would know then that their appointments that are super needed are being pushed up. So yeah, so it's just a matter of looking at your time frame within within the space that you have, booking it out further and further, then implementing time blocks so you can get your new patients in. So I mean, at the end of the day, that is still better, even with, like, in terms of optimizing your hygiene department. If that is the only thing you can do, then that is the only thing you can do. But it's always better that once you do that, because that's still the first transition phase, and then build out, that would be the ultimate, right? If you could do both. But not all of my practices can do that. But they're happy in that they can either, just be comfortable with the fact that the days that are booked. And most of the hygienists that I'm working with, they have a sit rate of about 95%. So that's less than one cancellation per day. They're working hard, and patients aren't typically not showing because they just know how important it is that they see their dental hygienist. And I know, like, doctors will say, well, how important is a hygienist? Well, like I said, the hygienist is the epicenter, the backbone. And the more professionally developed a hygienist is and understands themselves, the benefits of oral health, they can communicate that to their clients and create these trusting clients. I've got doctors, and I always say that when it comes to hygiene production, I like it to be about 30% of overall production. But I've got doctors that their hygiene departments are at 46. And when I say, yeah, that's great, but that's an indication you're not working hard enough as a dentist, they go, I don't care. I don't want to work harder. I literally like the fact that I can come to work. It's a super calm and slow day for me. I've got three hygienists that I'm monitoring, and that's all they want to do. And that's okay, as long as that's what they want to do. But they know that at the end of the day, the health of their clients are where they want it to be.
Wow. Okay. So then what is it that you're finding that's super challenging for dental hygienists to want to come back into this field? Why is it such a, I mean, I know COVID had a lot to do with it, but why is it such that it's hard to find a dental hygienist?
Well, yeah, a lot of hygienists left, a lot of hygienists for us baby boomers who have left as well, right?
Oh, okay.
And you know what I'm going to say, to try to attract hygienists back into the field, that is probably a very hard thing to do. So all we can really do now is work with the hygienists we have and to maintain them and retain them in our practices. I think the thing is with dentistry, it has for so long, like, it's a great profession and what we do is great, but the working environment itself has never been great, right? In terms of ergonomics, in terms of, a pension plan, things like that. Okay.
Oh,
That's never been great. So it's always been one of those jobs where you knew you weren't going to have a long shelf life within the industry. And you may not have enjoyed it, and it's based on the practice culture. So now with the shortage of hygienists, they have more options, right, where they want to work. So office culture becomes important. Our hygienists, our age group of hygienists have decreased. So when I'm teaching now, the majority of my hygienists are Gen Zs and millennials, and they expect a lot more. They not, and a lot of doctors will say, "Oh yeah, all they care about is the money." Not really. It's part of it, of course. If they're going to work in an environment like I just discussed, of course, the money is important to them. But what is even more important, and when I talk to doctors about attracting talent, is the fact that are they getting mentorship? Are they being professionally developed? And I kind of really like that about my Gen Zs. Like they're super or open to mentorship and professional development. And it's not even that they're open to it, they kind of demand it. So when I'm working with my practices and they go, oh yeah, Gabriel, you got all these great plans for me, but I'm going to have to find more talent in terms of hygienists. How am I going to find it? My point to them is just say that you offer this mentorship and tell them that you provide professional development for them. And culture, what a lot of people don't understand and how it's developed is through professional development as well. Because what happens with these newer grads coming out of school, they come into a culture where maybe they're not the only dental hygienist. They've got 2 or 3 other hygienists with varying degrees of experience coming from different schools, understanding curriculum that isn't current anymore. So to really improve culture is to align people. So, and that is part of it is through professional development. If you've got a whole myriad of different backgrounds and you align them all to the most current evidence-based literature, then the hygienists coming up or the clinicians, even the doctors coming up can get on board with what is going on in that culture. And I've worked with a lot of doctors that have sold, like doctors of my vintage have sold to younger dentists. And they come on board and they're going, okay, I'm still using paper. I have no radiographic AI. I have no radiographic dictation. Like I don't have an iTero scan, like all of these things. And my point to these doctors, especially if they want to stay on board for 5 years or maybe longer because they don't find their whole purpose in golfing, I actually help professionally develop them too, in terms of them understanding what the most current evidence-based literature is now and currently. And then I always, my point to these doctors who are selling is you're hiring people that are probably half your age, maybe more than half your age. And you have to understand, like, in terms of what they've learned, their generation, like what is a Gen Z like? What is a millennial like? And I teach up until about Gen X and maybe a few boomers still. But you've got to understand those different generations of people as well and what they're expecting and what they want to be able to accomplish. And yeah, the alignment is what creates the culture and what drives sort of people wanting to work within those practices. Because it's great to have doctors or senior hygienists because they come with all this great wealth of wisdom, but they still have to be on top of their game. Like you don't have the opportunity to fall back and say, I know enough. What I do works. It's not enough. Like dentistry is changing so rapidly. And like I said originally, it's so exciting. And I know there's people that are afraid of AI. I love it. I think that it just makes us better clinicians. It makes us more efficient. And if you really, like I said, understand or want to become a part of that next generation of clinicians, next generation of practices, you've got to be on board with that. And if you're a senior dentist selling to junior dentists and want to still be in dentistry, I hate to say it, you still have to be on top of your game too. Or you have to commit to going to play golf 4 days a week or 5 days a week and just give it up already.
Go fishing, right?
But you can't slack, right?
Yeah.
But you know what? It's funny because when I have done the transition professional development with these original dentists, they always say the same thing. Wow, I didn't think I could learn more. And thank you for helping me understand who's working, who's in charge now and who's working for me and where they're coming from, right?
So tell me, how does one mentor a dentist mentor a hygienist? I mean, what are some of the ideas that comes to mind when an aspiring, energetic, want to learn everything hygienists come into the office?
Well, they can mentor them through professional development. They can mentor them by giving them the autonomy to work within their college practice standards and the codes of ethics. Okay. Like basically make them a partner in overall patient care, right? The problems start when a doctor, like the best thing that can happen to the doctor is he gives up control. And he's not the smartest person in the room, that he allows his hygienist to be the smartest person when it comes to the preventative department. And then they work collaboratively in getting to the outcomes that they want to, because the doctor already has got his own field of expertise, which is the restorative dentistry. And then when I'm training teams, I'm training both the doctors, the hygienists, and the front end for some of my courses. And the doctors inevitably will say, well, can I just leave that to my hygienist eventually? I go, of course. We want you to trust that we know more about this topic in terms of prevention than you do. But the way you then mentor us is coming into the room. And if I can't get a set of radiographs because I need it for a patient who's got periodontitis, you then understand why I need it. You then have the conversation with the client in terms of, again, reiterating what I may have said to the patient, but was unable to get compliance. And then you also supporting and mentoring me by saying, at the end of the day, if we want to get you to oral health and maintain your systemic health, you do need to go forward with Gabriel's treatment plan. That is a great way to mentor. I've worked in practices where, after spending all this time creating value and educating my clients in terms of what is going on with them intraorally, the doctor walks in and sort of minimizes or dismisses everything that I've said. That breaks down the trust with the patient, because at the end of the day, and I always say this to doctors, although we should know more in terms of the preventative aspects of our clients' treatment, you hold more authority than we do. So if you don't work collaboratively with us and you're not mentoring and supporting us when you walk into that operatory, you can diminish everything that I've spent time working on. And then as soon as that trust is broken, they're probably not going to follow through with our recommendations. They're going to go, oh, doctor, I didn't think it was a big deal. And then that sort of ends the conversation.
Yeah, well,
So yeah, they play a huge role in trusting that you know what you're doing. And then if you feel that you don't, or you don't have the confidence, in making sure you get that professional development so that you do.
So have you ever had to deal with a situation where you had a doctor and a hygienist that were on the same wavelength, if you will, in terms of communication, and you had to kind of sort that out and help them understand the importance of continuing this work?
I think in general, when it comes to dental hygienists and dentists, there's always a breakdown in communication.
Yes.
And I come in, and again, I create the alignment around the curriculum so that both parties understand what needs to be done for the end product or the end result, which is optimal patient outcomes. I think that is the issue in most practices, is the breakdown in communication. I talk about challenges that I see when I go into practices, and one of them is the breakdown in communication.
Okay.
But it's not typically when I'm walking into a practice, it isn't a hostile communication. It's just the fact that the doctor will look at his patients and go, I'm not happy with my outcomes. Like, these patients are coming in to see me twice a year. They still have active perio. If I try to say anything to my hygienist, they get upset. I don't want them to leave because we already have a hard enough time keeping them. So it's a matter of, what do we do to bridge this gap in terms of me being able to talk to my hygienist and us working collaboratively together and me getting the outcomes that I want.
Yeah.
So that's really the breakdown. So I'm walking in almost like the hygiene whisperer, and I'm probably a lot of times not saying anything different than what the doctor wants. I'm just now aligning everybody to the hygiene scope, that what best practices look like in treating periodontal disease, and what the literature is saying. They say that 86% of practices are not providing the standard of care to treat periodontal disease. So it's not like, if a doctor is calling me, that's probably what's going on. He's going, okay, this doesn't make sense to me, but first of all, I don't know. I can communicate that I don't like what I see, but I don't know how to fix it. Can we get somebody in here that can help me give my hygienist the permission and the autonomy to work towards those goals? Most doctors aren't trying to get in the way of their hygienists. Or I should rephrase that. The doctors that I'm working with do not. The doctors that are getting in the way of their hygienists are never calling me because they think they know better, right? But the doctors who really, at the end of the day, just want to do what's best for their patients, they're calling me. And at the end of the day, it's significant to their bottom line too. But that's typically not the reason they're calling me,
Oh,
right? But it's a huge there's a huge benefit to looking at the bottom line of optimal patient care or results.
mm. So do you find yourself matching dentists with hygienists? I mean, I know you teach a lot of hygienists, and you speak on a on a high level with dentists. I mean, is there any matchmaking going on there?
Is there what?
Any like matchmaking, putting the dentist and hygienist together that the dentist was looking for in the first place? You might know somebody or a hygienist or a few hygienists that match well with a dentist that you're consulting with.
Well, typically the problem with what I do is once I create this very cohesive team and this very high level of perio practice, most hygienists aren't leaving, right? Because where are they going to go where they can work at that level and with that much autonomy and sort of and self and satisfaction within the industry? So I can find hygienists for doctors, but they're typically hygienists that aren't happy with their current situation. And then they're wanting to be professionally developed. Like that is the promise that I'm making to them.
Oh,
But I can't professionally develop a hygienist and then sort of move them around. I mean, on occasion, hygienists do leave mainly because they're leaving the area or something like that. But in general, I don't have as many hygienists on tap as you would think.
oh, wow.
But here's the thing: hygienists that want to be professionally developed are typically top tier hygienists. Like they care and they want to be professionally developed because they know there's more to the profession than what they're doing, and they know they can do more. And they really are committed to being lifelong learners. So doctors who are wanting to attract talent, if they promise professional development, they're going to get top talent because they'll attract those ones. They're not going to attract the one that just goes, well, I want top dollar, but I don't care, because they know that with being professionally developed, probably their responsibilities increase, right? And so more is expected of them for the same dollar value. So they've really got to be committed to patient outcomes because it is a lot more work. It's way easier to be a hygienist who doesn't care and just do it pro fee and not care if your chair's full and not care what the end result is once you do your pro fee.
Mm, yeah. So what are the challenges with dentists and the future of, and you might have touched on this, but I wanted to see if I can pull anything else out of this. Dentists going forward with, I know you talked about, why dentists are having a problem with just doing the pro fee and not going and doing the other 80% of the work that's needed. What are some of the other challenges that you see outside of communication, outside of the pro fee? Is there any other like challenges that you see that maybe we may need to cover as well?
Yeah, you know what? One of the big ones, and sort of a really big, broad one, is the fact that too many dentists, and I talk about a two economy system. One is the external economy, things like interest rates, too many dentists per patients, tariffs now, housing prices, all of these things are what I call external factors. And then we've got the internal factors, which is patient experience, a practice culture, professional development, internal marketing, creating value. And I talk about these two different economies and that most dentists spend way too much time on the external economy, which you don't have any control over. And every other person, every other dentist is experiencing the same thing.
Right.
So rather than focus on your external economy, why not focus on the things that you do have control over and you can change? You can change patient experience, professional development, team culture. You can change that. In changing that, like in controlling that and making the changes there, you can set yourself apart so that you become part of the elite 25% of practices that are producing 50% more. And even, and I talk to doctors about this all the time because I'm working with doctors that have another clinic, just kitty corner this way and kitty corner this way. Well, what is making them choose you?
Right.
And if they do, then what is making them what is making them stay there? It's the value you're creating. It's the experience that you're creating. It's the culture when they walk in there. It's all of that stuff. So those are the things that set doctors apart, right? That is actually a really big one. And, we have talked about communication. Well, another challenge is most doctors think that their hygiene department is a lost leader. That's a huge challenge. It's just like, are you kidding me? Like, this should be foundational. It's like having a foundation where you're building a condo on, right? It's foundational. Then we talked about the communication. We talked about mind blocks. No, I didn't.
No.
The other thing is in terms of mind blocks that clinicians have. What will my patient value? What will they pay for? What won't they pay for based on insurance support? That's a big one. And the mind blocks are not with your patients, they're with you.
Mm.
And then the way clinicians talk about periodontal disease, they talk about it like it's nothing. It's just a little bit of inflammation. And until such a time that we change our language and we understand that periodontitis is no different than atherosclerosis, Crohn's, colitis, things like that, as in terms of autoimmune diseases, until you change your language that it really is a serious disease and it needs to be taken seriously, that is a huge breakdown too. And then we did talk about sort of the different myriad of experiences and things like that and aligning to the most current literature, which is super important. I mean, since the 2018, there's been a change in the periodontal classification. And the literature would say that when something comes out in research, it takes up to 20 years for it to show up clinically. And when I'm training my teams, and even though this classification came out in 2018, most clinicians still, if they are implementing it, they still don't fully understand it and are implementing it really inaccurately, or they're not implementing it at all. The 2018 AAP is the most current evidence-based literature that we need to align to. So it should be forefront in terms of us really truly understanding it, because then it makes you understand and it helps transition you into that next generation. So that's a huge challenge as people are going, it's too complicated, that I don't want to learn that. Some of the other breakdowns, mind blocks, I think I've just about covered most of them. And it's also, I talk about clinical breakdowns as challenges, because I find when I say 86% of practices aren't providing the standard of care to treat periodontal disease, what I find typically when I'm walking into practices is that the very fundamental things that need to be done, like adequate radiographs to make an accurate dental hygiene diagnosis, isn't happening. A comprehensive oral exam isn't really that comprehensive. Maybe being built out, but it's not that comprehensive. And then really understanding the literature and how many appointments it really takes to get a person to the parameters of health, that's not really happening either. And those are those practices that are very general practice. 99% of the patients are getting approved. So those are the challenges, the big challenges and breakdowns that I try to resurrect in my practices. And just by resurrecting and fixing those challenges, we start to work within our what's called best practices. We start to work within what our college expectations are and our codes of ethics. And this translates into better patient outcomes.
Ooh, kind of scary there. So tell me some of the positives, some other the positives that you see in dentistry
in the future.
Yes.
I love AI. When I start to think about what our expectations are in terms of diagnosing periodontal disease, because that's my field of expertise, with radiographic AI, that makes it way easier, more efficient. I love things like, when I talk about the 3 different parameters that cause the breakdown of the periodontium. I love the digital scanning devices that are out there, because it shows you things that you can't just look into orally and see, like traumatic occlusion, malocclusion, just changes within even the soft tissue that occur. things like, yeah, I don't know. I know they've got in terms of dentistry, other types of AI that that's starting to come up. I like the fact that it shows you in terms of AI things that you may not have caught, but you still need to use a whole lot of critical thinking to understand it. I like software that will bring together all of the assessments that we take within dentistry, starting right from your medical dental history all the way through your comprehensive oral exam assessments, your radiographs, and then it gives you an outcome or spreadsheet in terms of risk factors and things like for your patients so that they can see if we do not do this, what's going to happen. If we do not get control of your weight, how it will affect the breakdown of your periodontium. We don't control your sugar levels and things like that. Like it's just all very visual so that when patients are coming in, it's no longer just what we think and it's super subjective. It's super specific and utilizing our critical thinking on top of that. And then us being able to show patients, because we deliver a lot of information that, wow, they walk out and they say that, you really only retain 10% of what somebody says to you, right? And you walk out and you're a little bit confused, but with all of this AI, it actually will deliver you something that you can take home and then read and review and see if you understood, or if you don't, you can even like communicate with your clinician. And the other thing is like when I talk about all these things that we can do, it's not as daunting as most dentists think, because there's really three aspects of business that if you increase these three aspects of business will drive substantial growth in revenue. And when it comes to the preventative department, the three areas is, do we know how to drive or increase patient price? And that's easy because, like I've already said, I typically don't see enough radiographs to come up with an accurate dental hygiene diagnosis and support all the rest of the process of care. I don't see enough comprehensive oral exams. So that drives the price per patient. Then if you increase the number of patients you see in a day, and again, if you move away from just doing a prophy for every patient and move into what we call active periodontal therapy, then you're going to probably need to fill more hygiene spaces in the day, whether that be filling your appointment scheduler or having another half hygienist or full hygienist. If you then also increase the number of visits per client, and that is just in visits in terms of 6 months, 3 months. And we know that 50% of the clients have periodontitis. So they require 4 appointments in a year. If you just increase those three factors by even as much as 10%, just 10% more, you will get an outcome of 33% increase in your revenue. If you increase it by 20%, it's an increase in revenue by 76%.
Wow.
If you increase it by 26%, it's 100% increase. So how hard is it to increase patient price just by doing the right thing? How hard is it to see more patients in a day just by implementing best practices in treating periodontal disease? And then how hard is it to get your patients into one more appointment, knowing that 50% of them should be on a 3-month recare? It's not that hard. It's very small increments that can drive and make a huge difference in your bottom line. And that small difference then makes a huge difference in what we call EBITDA.
Yeah,
right? Right? Like even adding one more hygienist income can increase your EBITDA by about 76%. If you started as a $1 million 1 million practice to a 1.3 million practice, that's 76% increase, right? Just by implementing best practices all the way along in terms of the process of care.
So
I find that all very doable, achievable. I find it AI very exciting. I don't know. Like I said, for about the third time, I just find the whole profession still super interesting and exciting. And The thing is that with clinical hygienists, at some point, clinical hygienists, once they get to a certain level and have enjoyed that part of their life, there's so many other things in dentistry also they can do. Not that we want them to leave us clinically, but at the end of the day, just the way the profession of dentistry is evolving, it's a great field. It's a great field.
That's great. That's inspiring. So tell us, what does your list of services look like? How do you go in and actually talk to a dentist? And I know this is like maybe a loaded question, because you're going to see, um, I mean, they come with different problems, obviously. But what is your typical process like? What does it look like when you go in there and you're talking to a dentist? Do you give them information before you come in, or do you sit down and talk to them and chart out what they actually look like and then come back and give them information? How does that work?
Well, typically when a doctor calls me, because I don't do cold calls, like there's no point in walking into a practice where they think everything's fine, or they don't have a need to call me. So when they're calling me, I typically will ask them, what are their pain points? Like what do you think is going on in your practice, and is the reason why it looks the way it does, or you're unhappy? And then the second thing I like to do is to go see if what they surmise is true. And what I do is I do a chart audit. I will go into their hygiene department and I will audit like a new patient. What happens when a new patient walks in the door? What happens to a 3-month hygiene patient? And then I will have the sit down conversation in terms of what's really going on. Where's the breakdowns and what they think is going on, and what's truly going on or breaking down. And then typically I find 5 breakdowns.
Mm,
In the 15 years I've done it, it's always the same 5 breakdowns,
wow.
besides the challenges of communication and things like that. I mean, clinical breakdowns. I typically find 5 of them in varying degrees in every practice. And then what I do is I've created workshops around those breakdowns to try and resurrect them and get you back to sort of, like, I transition people back to what I call best practices, and create an understanding the literature, what that looks like, and systems and processes, so that now we can integrate those best practices clinically. So each one of the workshops that I've created builds on concepts, but at the end of the day, it transitions this practice to that very, very perio focused practice. The first course I teach is the 5 clinical breakdowns resurrected. And like I said, there's 5 usually clinical breakdowns that I give a high overview, and we start integrating. In the first, it can be as fast as every other week we take a module, because in that first course, there's 5 modules because of the 5 breakdowns. And then what we do is we move on to higher learning. Okay, so now we got the basics, the foundation down. Let's start working on it to transition us into the next generation. So then we start to focus on a medical dental history. And it's not just a medical dental history that keeps your patient safe. It's a medical dental history that's very focused on, again, driving patient outcomes and driving treatment. And then the last course is called the WOW workshop, which is just the weekend optimization workshop, where we talk about treatment planning, implementation, things like that, that will then really get us to the parameters of health with our clients. So once we're finished that, then if they want, and I always like this, is I support their hygiene team. The first course, the 5 clinical practices resurrected, is typically taken by the entire team, because they have to understand what's going on. Medical dental history, because it runs from the front to the back, same thing, the entire team takes it. But the last course, the WOW course with the 6 modules, it's only for dentists and hygienists. And then once that is done, I do what's called chart audit sessions with just the hygiene team, to make sure that everything that they have learned, they totally understand clinically, and it's appearing clinically, so that at some point they no longer remember how they used to do it. And then we create mentorship. So anybody who's coming on board after that, they get assigned a mentor. And that mentor might, and they go through the course. They practice that I've worked with and have gone through my workshop series and has transition from a very general practice to a very focused practice. Every new hire in terms of hygienists after that goes through the program, they get assigned a mentor, and then that mentor helps them. So there's certain things, and I don't care if you've got 25 years of clinical experience, we don't allow you to do until you go through those courses, so that you're aligned to the literature and aligned to the team, and the same message gets given to that patient, so there's no confusion. And with my new grads, the message might be, this is your periodontal condition. This is how many appointments it would take. I am a new grad and I do not work at this level of periodontal disease. I am going to book you with a more senior hygienist who can do it faster and more efficiently than me. Something as simple as that. I always say that, the best combination of practices are those practices that have senior hygienists that have the technical skills, and then my new hygienists who have the acumen of the new curriculum, who then can work off of or bounce or have those patients go to those senior hygienists. These are the best practices, because it's almost like you don't have to send them to specialists. You're going to send them to the specialist in your practice. And then that hygienist at some point, if surgical periodontal therapy needs to be done, they will have done everything till then and then send them off. And then within 3 years, my senior hygienists have the confidence and the clinical skills to be able to work at the same level. And we give them the opportunity to work their way up to doing that. So it's, I don't know, like I said originally with my Gen Zs, they demand it. They want mentorship. They want professional development. They want guidance. That is sort of really endearing about them. Whereas, I don't know, I don't remember coming out of school and thinking I needed anybody to help me with anything. So they're easy to work with, very easy to work with, easy to mold to whatever your culture is. And hopefully it's a good one. But yeah, easy to attract them.
Yeah, I
in
like
terms of talent.
I like the system. And
Mhm.
are you at liberty to share the 5 breakdowns?
Oh yeah, they're simple. Usually, and I've already talked about 3 of them. One is I don't usually get enough radiographs to make a comprehensive dental hygiene diagnosis. And even the AAP, who developed the new 2018 AAP, says when you have a patient with periodontitis, you need a full mouth series. I'm typically not getting that full mouth series. So right away, I can't make an accurate dental hygiene diagnosis. So my diagnosis is off. Well, then I don't, then everything else falls apart. Okay. The other thing is my comprehensive oral exam, like where I'm getting all of the assessments, mobility, a very like mobility, pocket depths, all this stuff. I don't get that either. So again, the AAP says first thing is you need a comprehensive oral exam. Okay. Then the third one is we're not providing best practices in terms of treating periodontal disease. All we're doing, the majority, 86% of practices are only doing prophies. The fourth breakdown that I find is there's a big breakdown from the front to the back. And one admin person said it like this. She says, 3 feet from the back to the front, all the information that you guys did back there gets lost. So we find a way to transition all of that information and making sure that all the work that we did at the back gets to the patient or gets to the front end so that then they can follow up on it. And then the fifth one typically is that the clinician isn't billing appropriately for that hour. And up here in Canada, it changes province to province, but I know down in the States, it's the same sort of thing. And again, when it comes to billing, again, doctors are very trepidatious to talk to their clinicians about it because, again, they have a shortage and they don't want to upset anybody and things like that. So those are the top 5 breakdowns. So we spend a lot of time talking about that. And like I said, all of my practices have these breakdowns. Maybe not as like in different varying degrees, but they all exist. So they go through, and like I said, if I discovered a 6th one, I would probably create another workshop around it. But it's been the same 5 for 15 years. So that's what I try to fix, the foundation of what we call ADPI. Try to fix that. That's all. And then if I get lucky, then I also start to include things like LBR, like lasers and other things, saliva testing, things like that. If I get so lucky as to get them to that level, hopefully that team will continue to take professional development and grow and grow and grow. And that's ultimately, I think, as time goes on, the expectations from your clinical hygienists will go up. Patients will become more informed they will expect or demand more as time goes on. Like I said, 15 years ago, when I was teaching about the oral and systemic association with disease, most clinicians would look at me with like not really understanding. Now that's mainstream. But the same sort of thing with everything else that's coming our way in dentistry. Eventually, the public gets to know about it, and then they demand it, and they expect it. And if they're not getting it within your practice, they're going to try to find that practice that is on top of the latest technology, AI, treatment, all of this stuff.
Providing value. Wow. So, in closing, what would you say to the young dentist and the young dental hygienist coming into the field? What would you give them as a piece of advice?
I would just say to them, as a program director of a school, we make our sort of graduates promise us to be lifelong learners. And I would say that just keep on that trajectory, because dentistry is changing. And like all medical professions, it's changing very quickly. And you can get left behind, and you can think that you know enough or it's good enough, but really it isn't. Do you know what I mean? Like some things that I learned back when I learned it, it's totally obsolete now. In fact, some things that I learned 5 years ago is obsolete, right? It constantly evolves. Some of the treatments or interventions that we used to think were the best, and now we know it's absolutely the worst. Do you know what I mean? So I would say, with the profession being as exciting and dynamic in terms of where it's going and how fast it's moving, just commit to being lifelong learners.
Mm-hmm. Mm-hmm.
Right? And never think that you know enough. There's a saying out there that, the problem with integrating new technologies and things like that is the fact that there's this illusion of knowledge that people have. And that's exactly what it is that prohibits them from sort of getting better, being better, and doing better.
Mm-hmm. Mm-hmm.
Like I said, I've been in it for a very long time.
Yes.
And I'm still excited about it.
That's awesome. So if someone wanted to get in touch with you, Gabrielle, well, how would they do that?
Me? Oh, you know what? My website is www.gemdentalexperts.com, or you can contact me at GEM at gemdentalexperts.com. You can get a hold of me that way too. I love lecturing. I love educating. When I was a program director and I got approached by a doctor who wanted me to transition his practice into a very perio-focused practice. I was at one point working as a program director and helping him with his thing. And I was thinking, wow, this is like two really big jobs. And I said to myself, you know what? I like to educate. That is my thing. I think I know how to take the literature and distill it down so it's clinically applicable and make people really understand it and be passionate about it. So all I was going to say is, even if you just want to contact me to speak to your group or some sort of conference or something like that, I'd love to speak on the topic. I've been talking about this nonstop for the last 15 years. And like I said, I've been in the dental field for 40. So I've seen a lot of changes, and I suspect I will see probably double the amount as time goes on, just because of how quickly the profession is evolving. So I'm around. So I plan to be around for a little bit longer, just because I love it so much.
Awesome. Awesome. Well, Ms. Major, thank you so much for joining us this afternoon. Just a treasure trove of information you shared with us today. And I'm sure those that are watching will get just what they're looking for and more.
No, I'd love to hear from them. That'd be great. And I appreciate you having me on and giving me a voice and having this time to talk about something that I love to talk about.
The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers and boost the ROI on your business. Is there a topic you're passionate about, or someone in the dental community who should share their story with us? We want to hear from you. Email your suggestions to the Wealthy Dentist Podcast at gmail.com, and let's create content that informs, inspires, and uplifts the dental world. Your ideas could spark our next big conversation. Let's make it happen. I'm Ward Powell, your host at the Wealthy Dentist Podcast, thanking you for being a part of our journey.